Good day, everyone. Today, I am in front of you to talk on the topic of low back pain or lumbar disc prolapse, which is a very common condition we see. I am Dr. Sanath, consultant neurosurgeon at Renova Hospital, Kompally. When coming to the symptoms of this condition, the most common symptom will be the low back pain or pain in the region of the buttocks or pain radiating from there into the leg or predominantly the back side of the leg till the foot. So the first symptom is usually pain, and as the condition progresses, the problems will increase slowly in intensity, severity, and duration, and also by addition of new symptoms such as weakness of the foot or numbness of the foot and so on. If the symptoms are neglected and the condition progresses, the final symptoms would usually be spreading of the symptoms to the other leg and also the weakness of the sphincteric control such as urine or motion or sexual conditions. So this is the last symptom, and the most common presentation being pain. So the pain patient usually comes to us with the first symptom of pain only. It is usually precipitated by bending forwards or lifting an extraordinary weight or unaccustomed physical exercise such as sports injuries or any professional injuries. So the first symptom, which is pain, when we encounter, we usually advise the patient to take painkillers and also adequate rest so that the condition causing the pain is subsided. So in conditions where the pain doesn't subside or the addition of new symptoms such as radiation of the pain to the limb is added for a few days, then we usually go for evaluation of the condition and to rule out major neurological compromise such as disc prolapse and other conditions, rare conditions such as tumors. So when we encounter this problem and we ask for an MRI of the lumbar sacral spine, where the condition of the bones such as the vertebral bodies, the nerves, the spinal cord, and the muscles can be seen. So when the conditions of these anatomical things are noted, we sometimes find that the soft cushion-like material between two bones called the lumbar disc usually is prolapsed into the uh, area of the spinal canal where the roots and cord are there, and therefore causing pressure on the roots and leading to radiation of the pain along the supply of the nerve root along the leg. So when this condition is noted in the early stages, usually we note only a mild disc bulge where the patient is advised strict bed rest for a period of 1 month at least, and to totally avoid sitting continuously for long periods, lifting heavy weights more than 5 kilograms, or bending forward to pick up things. So, and if this condition and is advised is followed correctly, then the pain might subside after the period of rest and medication, followed by going back to normal activities with precautions. So the precautions usually being avoiding to lift weights as also bending forwards. And if the patient has unexpected bending forwards or lifting weights, the condition is again aggravated, followed by development of new symptoms. And in such conditions, usually the disc prolapse has increased, and if it is really proved on MRI, then we advise discectomy. Discectomy is the surgical procedure where the prolapsed or the extruded or the part of the disc between the two bones of the spinal canal is coming out and pressing on the nerves. So we usually advise removal of this part of the disc which is coming out and pressing on the nerves to give the relief to the nerve which is being pressed and also to avoid weakness and numbness. So in this surgery, usually there are many types of approaches which can be used. Most common approach which was earlier used was an open procedure where laminectomy or the removal of the posterior part of the vertebral bone followed by removal of the disc which has been pressing on the nerves is done. And nowadays, with recent advancements in endoscopy, there are minimally invasive techniques which can be used, such as microscopic discectomy or endoscopic discectomy, where the incision is limited to less than 1 inch in length, and the approach to the disc is through the small corridor without disturbing the majority of the muscles and bones and removing the disc which has come out, therefore relieving the patient. So in open procedures, usually the rest period is usually 1 week, whereas in endoscopic and minimally invasive procedures, usually the rest period is 2 to 3 days. So in many cases, if the patient is comfortable, so even same day discharge can also be advised. So after the surgery, usually the patient is advised rest for a period of week to 10 days, followed by return to daily activities with precautions. In conditions where the pain doesn't subside even or the pain again comes back after a period of time, usually the follow-up is done with an MRI of the lumbar sacral spine to note for any residual disc or any recurrence of the disc problem. So it is advisable to all patients so that the best possible thing is to avoid this prolapse of the disc by avoiding bending forwards or lifting weights, and try to develop the strength of the back muscles with physiotherapist advice using back strengthening exercises. Thank you.